Good day, students. Welcome to today's lecture. Today we will cover several important drug classes that you will encounter in your nursing practice. These include diuretics, drugs for benign prostatic hyperplasia in bracket BPH, treatment of erectile dysfunction, antipsychotic agents, and Antiparkinson drugs. I'll guide you through these important topics. To start, let's introduce the key topics we'll be discussing. We'll be exploring how diuretics help the body get rid of extra water and salt, making them essential in treating conditions like high blood pressure and edema. We'll also look at medication used to treat BPH, which help improve urinary flow in men with an enlarged prostate. Then we'll move on to treatment for erectile dysfunction, which address difficulties in achieving or maintaining an erection. Next, we'll cover antipsychotic drugs such which are vital in managing mental health disorders. Finally, we'll discuss anti-Parkinson drugs, which help control symptoms in patients with Parkinson's disease. Understanding this medication is crucial for providing the best care and ensuring patient safety. Let's begin with diuretics. Diuretics are medications that increase urine production, helping the body remove excess water and salts. They are commonly used to treat high blood pressure and reduce swelling caused by fluid retention. There are three main classes of diuretics: loop diuretics, such as furosemide, which are powerful and act on the loop of Henle in the kidney; thiazide diuretics, like hydrochlorothiazide, which are often used for hypertension; and potassium sparing diuretics, such as spironolactone, which help to retain potassium while still promoting fluid loss. So let's discuss drugs for benign prostatic hyperplasia, or BPH. This condition involves a non-cancerous enlargement of the prostate gland, which can lead to urinary difficulties. The main classes of medication used are alpha blockers like tamsulosin and alfuzosin, which relax the muscles of the prostate and bladder, neck, to improve urine flow. Then we have 5-alpha reductase inhibitors such as finasteride and dutasteride, which reduce the size of the prostate by inhibiting the conversion of testosterone to dihydrotestosterone. Additionally, phosphodiesterase 5 inhibitors like tadalafil are used, which can also aid in treating erectile dysfunction. Erectile dysfunction, or ED, is a condition where a man has difficulty achieving or maintaining an erection sufficient for sexual intercourse. The primary treatment for ED are phosphodiesterase type 5 inhibitors, including sildenafil, tadalafil, and vardenafil. These medications work by enhancing the effects of nitric oxide, a natural chemical that relaxes the muscles in the penis and increases blood flow. Another option is prostaglandins E1 analog like alprostadil, which can be administered via injection or as a urethral suppository. Now let's move on to antipsychotic agents. These medications are crucial in managing mental health disorders such as schizophrenia and bipolar disorder. There are two main classes: typical antipsychotics such as haloperidol and chlorpromazine, which are older and can be effective but often have more side effects; and atypical antipsychotics like olanzapine and risperidone, which are newer and tend to have fewer side effects. Now, these drugs work by blocking dopamine receptors in the brain, which helps reduce symptoms like hallucination and delusions. So finally, we have antiparkinson drugs, which are used to manage the symptoms of Parkinson's disease, a neurological disorder that affects movement. The main classes include dopamine precursors such as levodopa, which is converted to dopamine in the brain, dopamine agonists like pramipexole and ropinirole, which mimic dopamine effects, MAOB inhibitors, that's monoamine oxidase type B inhibitors, such as selagelin and rosagelin, which prevents the breakdown of dopamine, and COMT inhibitors like entacapone, tolcapone, which prolongs the effect of levodopa by inhibiting its breakdown. Yes, COMT stands for catechol or methyltransferase inhibitors. Yes, they tend to prolong the effect of levodopa in the brain. Yes. To conclude, we've covered several important drugs classes today. We discussed diuretics by managing high blood pressure and edema, drugs for BPH to improve urinary flow, treatment for erectile dysfunction, antipsychotic agents for mental health disorders, and antiparkinson's drug to improve movement. Now, understanding this medication is vital for nurses, okay, as it helps you provide the right treatment and ensure patient safety. This knowledge is a fundamental part of your role in healthcare, okay. It all starts from here. Thank you for your attention today. I hope this presentation has helped you understand these important pharmacological agents. If you have any questions or would like to discuss any of these topics further, please feel free to ask. You can also reach out to me or type your question in the comments, or please don't forget to leave a like. Thank you for your attention. I appreciate. Thank you very much. Well done.